Hi dear doctors, welcome to the class of Kids Covery. I want to extend a very warm welcome to the class which is very much potent to give you one MCQ correct in your competitive exam, and of course it is having a high potential when it comes to your university vivas and examinations also. So coming on to pediatric infectious diseases, and the topic is rubella. Rubella is also called as German measles. Okay, so I know you must have heard this vaccine called MMR, that is measles, mumps and rubella. So R and M are actually same also. That means rubella is actually called as German measles. Okay, German measles. So this belongs to an RNA group of virus. So very easy to remember, R rubella and R for your rubella and R for RNA viruses, and the family is actually Toga viridae. Okay, so Toga viridae. Okay, so this is a classical rash of rubella, classical rash of rubella, and this is a classical finding of rubella that is called as congenital cataract. Okay, so there is a congenital cataract that is a classical finding in rubella. So I have told you that rubella is actually enveloped virus. Rubella is having icosahedral symmetry, and rubella is having a linear, then single-stranded RNA virus. Okay, so if you can remember, this is the mnemonic that RNA is actually, okay, let me tell you, RNA, R for rubella. Okay, that's very simple. Okay, double L is coming, so double L is actually linear. Okay, and rubella, E is coming, so E for enveloped virus. Okay, and icosahedral symmetry is something which you have to remember. Okay, so rubella is actually contagious from 1 week before the rash and 1 week after the rash is going to fade. So for example, this is the period of the rash, so 1 week after and 1 week before the rash, this rubella is going to. So I always teach students like this. Okay, this is rubella, so this LL is just remembering 1 so 1 week before, 1 week after, and R, of course, rash and rubella is starting from R. Again R, that means it is going to travel, it is going to get spread with the help of respiratory droplets, and yes, transplacentally is also the spread is known, and that is why that is where it is responsible for formation of the R in the torches. Okay, so incubation period is actually approximately 15 days, if you can remember, and of course the host, you know that humans are the only natural host. So humans are the only natural hosts. Okay, and that is why, you know, there's a large scale MMR program, measles, mumps and rubella, which we do. Okay, so after infection, what happens? There is fever, just like any other fever. There is a maculopapular rash. Okay, there is a maculopapular rash. So I always teach students like MMR. I mean, if you want to learn rubella, remember this MMR, and M for what? M for maculopapular rash. And similarly, there is going to be lymphadenopathy also. Okay, there is going to be lymphadenopathy also. Okay, so after incubation, you know that there is fever, there is lymphadenopathy, there is characteristic rash. There is also an association with a non-exudative conjunctivitis. Okay, and that which is actually called as Forshammer spots also. So what is, so there is a non-exudative conjunctivitis, as well as there are Forshammer spots on the soft palate. Okay, so very simple to remember this. See, Forshammer, S and O coming, so S and O coming. Okay, Forshammer is actually, and R for what? R for rubella. So R for rubella, and S and O means soft palate. So there are soft palate spots in rubella, that is called as Forshammer spots. And yes, of course, there is a non-exudative conjunctivitis also. Okay, so rash, the pattern of the rash. Okay, so rubella, it is going to start on the face, then it is going to go to the extremities, and it is similar to the measles. Okay, so very simple, from the face going to the extremities, from the face going to the extremities. Okay, just like some classical dancers, they do like this. Okay, so this is the way to you can remember. Okay, so what are the other symptoms in rash? See, polyarthralgia, polyarthritis is the common symptom which is seen with the female. Okay, after that you have got something which is called as the pathology of congenital rubella syndrome. Okay, now we will discuss a little about the congenital. So I have told you, either it can enter via the respiratory tract, or it can enter transplacentally, congenitally. So we are more worried, more bothered about the congenital transmission. And once it is going to go, what happens? Rubella has a tendency to kill the blood vessels. Okay, that's why there is a blueberry muffin rash which is there. Okay, rubella. So RUBELL. So Bella or blue. So it is going to have what? It's going to have a blueberry muffin rash. There is a history of hepatosplenomegaly. There is a sensory neural deafness, patent ductus arteriosus, as well as you have got cataract. So how to remember it? Very simply, see that triad is PSC. PSC, what is PSC? So from your knowledge of ophthalmology, I think you know that posterior subcapsular cataract, PSC, is the mnemonic. So what is P? P for patent ductus arteriosus. That means there is a duct actually between the pulmonary and the aortic circulation. Okay, in the aorta and the pulmonary artery there is a duct which is there. Okay, let me just teach you a little about it. So what happens is, like, if this is the heart, this is the aorta, and this is the pulmonary vessel. In the fetal period, the lungs are not mature, so we just don't want much blood to enter into the lungs. So there is a connection between the pulmonary artery and aorta, so that the blood can go from the pulmonary artery to the aorta, and the maximum blood is going to reach to the system. Okay, so PSC, 1P is patent ductus arteriosus. What is S? S for your, yes, what is S? S is sensory neural hearing loss. And what is C? C is actually the cataract or the congenital cataract. Okay, congenital cataract. Now one thing I would like to teach you, other than this posterior subcapsular cataract, see, you know na, like okay, let me just teach you. One is the microcephaly, which is associated with this. Other is the intellectual disability, which is associated with this, which are these things. Okay, blueberry muffin rash. Okay, blueberry muffin rash. And H for what? H for hepatosplenomegaly. So rubella, PSC, and one other thing, that is him. So he is having PSC, him PSC. So H for hepatosplenomegaly, I for intellectual disability, and M for microcephaly. Okay, so diagnosis, of course, the clinical diagnosis is the one. Then you can perform other microbiological things. Now remember, the treatment is actually a supportive therapy, and you, I think, know that, like, MMR vaccine should be taken, okay, at 12 to 18 months, and the schedule we'll discuss, don't worry. So MMR vaccine is the prevention that is important. Rare complications, see, rarely it shows complications, but if the complications are there, it's going to be panencephalitis and thrombocytopenia. That means the platelets are going to get decreased, as well as there is panencephalitis which is going to occur. So this is it about the rubella, and my question for this class is, what are the organisms responsible for giving blueberry muffin rash? Okay, what are the organisms responsible for giving blueberry muffin rash? Thank you so much for joining. We'll see you in the next class.